As TiECon Pune 2025 is just around the corner, we decided to visit the NCL Venture Center in Pune, India's leading technology business incubator dedicated to supporting science-based startups and innovators. With a mission to nurture deep tech entrepreneurship, the Venture Center has been instrumental in fostering groundbreaking innovations and empowering aspiring entrepreneurs. To gain deeper insights, we had a conversation with Dr. Premnath V, Head of NCL Innovations at CSIR NCL and Founder Director of Venture Center. Let's dive into this insightful conversation.
Hi, and good morning, good afternoon, good evening, because we do get people from all around the world to our TiECon in Pune, and we have been lucky to get Dr. Premnath, the mentor-in-chief, if I can call him, for Venture Center here in Pune. He is one of the speakers, rather the panel moderator, and the brain behind this panel. So I caught him for a short conversation to see what he has in mind for us during this TiECon, and also in this area of medical technologies and healthcare, which is a very thriving discipline where a lot of entrepreneurs are coming, and also researchers taking their research and their professional work to entrepreneurship. So Dr. Premnath, first of all, thank you very much for your time.
Thank you.
And I know you and I are friends, and whenever I say Dr. Premnath, you get little, this thing, but I will continue to use that. He's an ID Bombay alumnus and also a PhD from MIT, which is a big thing. And we are lucky to have you in Pune here, sir.
Pleasure.
And this venture center with its wonderful surroundings always been a place of pleasure for me when we come to work with your entrepreneurs. So tell us about this panel that you have at TiECon Pune, which is just about less than 3 weeks now.
Yep.
Yeah.
I'm actually looking forward to that panel discussion because the panel has a very interesting group of young entrepreneurs who are developing ideas in the medtech space, generally in the medical technology space, with including different areas like therapeutics, which is basically approaches to treatment, diagnostics, and as well as diagnostics with AI, and as well as other techniques which are essentially assessing, evaluating, mapping the way the human body works, or different parts of the human body work, and then build businesses around those kind of themes. I think the group we have uh, is actually includes some of the brightest people I know who are pursuing some very outstanding ideas. For example, Parul, who is working on therapeutics, is pursuing something which I think is absolutely path-breaking, because in the autoimmune disease space, there's hardly anybody who is looking at a non-immunomodulatory approach to therapeutics. But let me explain what that means. Basically, an approach, so autoimmune diseases are those diseases where the body is attacking itself. The cells, our own cells, are attacking some parts of the body, and usually the therapy involves managing the immune system. Right. This is the first time that somebody is taking an approach which does not involve modulating your own immune system.
I see.
So it's indeed a breakthrough. We are really looking forward to results like that. Similarly, CareNX by Doto Health, for example, is developing new techniques for monitoring the fetus while it's in the mother's womb, which are actually very interesting, and they're in a very competitive space with very large players, but they have created a niche for themselves and are able to address the needs in a lot more focused way. So such examples actually, you can see that they have considerable potential for large scale impact, right? And when you work with human health, it's actually very satisfying at the end of the day to see those products reach the market, change, change people's lives, and have impact which you cannot imagine usually in any other domain.
Correct.
So the medtech space is something which I think is something which is very exciting for most people who want to hear about how the world is going to change around them, especially with regards to health. But the other important aspect is that this is actually an example of a deep tech kind of a startup, right? A medtech as an example of deep tech startups. And if you look at, and there are many learnings which can be borrowed from medtech and applied in other deep tech startups, and those learnings I think are very relevant across the board, right? So I think this panel discussion, I think, will bring out some of those aspects in brief ways, and I think you'll get a glimpse of different types of companies looking at human health and solutions for it in a very different way.
Different ways. It's very interesting you mentioned that. Naganan Doraswamy, Idea Spring Capital, he has a session upfront on deep tech, and I was in Bangalore and had a conversation. I wish I had recorded like this, but I'll probably reach out to him again.
Yeah.
So he also sets the stage, and one of the things he made, comment he made was, this is about science being taken to, for larger good and the gestation and everything else. Before I go into medtech specifically, I want to put on my computer science and data hat first. We are kind of privileged that we work with people like you and build our own things. For example, data science has taken a huge leap forward because of the nature of data that we had to organize to solve the problems that you're talking about.
Exactly.
Diagnostics.
Yeah.
Interestingly, diagnostics was the first application, early stage artificial intelligence applied, and it continues to be applied today.
Yeah.
So there is a learning for people who are building databases, data science, data sets, large scale data, deep side data. Listening to your panel and your panelists, because that's what it looks like to me.
Yeah.
Right? Okay. What is there for, let's say I'm in retail, I'm in some other domain. What is it that I can take away as a founder from this panel?
Yes. So first of all, to add a couple of points to what you said, the way I think about some of these businesses is about basically bringing together a given problem definition and a set of solutions and toolkits. And of course, today data science has taken a life of its own.
Correct.
And it's enriched our toolkits in new ways,
Correct.
including AI and so on and so forth. But when you address a problem which is relating to health, this is one set of tools that you have to bring to the table. But sometimes you also have to bring other sets of tools,
Correct.
including hardware,
Yeah.
new sensors, and many other things that you bring to the table when you're trying to analyze these. But these are very exciting times, because I don't think we have ever had so much power at our disposal.
Correct.
Like, for example, just computing power,
Yeah.
the ability to do so much analysis, so much data collection, so much miniaturization that is possible. I think all that is sort of makes it so exciting.
Actually, I sometimes feel that computer science version 2, after 60 years of version 1, is just about to begin.
Yeah.
And medical, medtech will sort of carry us along, and hopefully we are able to deliver chipsets that might go inside the body to solving some of the problems that today look like insolvable. What do you think about it?
Yes, in fact, the typical one other interesting thing about medtech is it typically poses very difficult problems, right? So they are the earliest ones. They're not necessarily the lowest hanging fruits,
Right.
but they are the ones where the potential impact being larger also attracts larger investment sometimes, and also allows for more risk taking sometimes, because
Yeah.
the domain itself has so much potential in terms of market impact, right?
Correct.
But you're right, I think all these parts of the puzzle, right, including novel sensors, wearable electronics, bioelectronics,
Correct.
data going into the cloud and being analyzed in very powerful ways, the new artificial intelligence algorithms that are coming out, the kind of miniaturized mechanisms we have for transmitting, displaying data, all these are going to really transform, I think, medtech. And as you said, even the chips, the brain computer interface, for example, it's great to be able to see people who haven't walked for so many years walking once again.
Exactly.
Right? That shows you the true power of not
yeah.
only technology, but also the power of entrepreneurs to make a difference in the real world.
Correct.
And I don't think there's anything more satisfying than that, right?
And coming to venture center several times, one thing I realized was that most of the startups that you have assembled here has some hardware or the other.
Yeah.
It could be an arm of a chair, or
Yeah.
it could be a chipset or something. And in fact, I reached out to a colleague of mine from Mojo Networks. He was our product management. He built the product management. And because we were dealing with network, so our piece was largely software, but we dealt with devices.
Yeah.
And that part of product management where you're actually seeking these devices but making sense on the commerce side of it.
Yeah.
Also, founders need to know and learn.
Yeah.
Another question, is it
Yeah.
possibly because of the deep tech that I see more PhDs coming out and doing entrepreneurship?
Yes, in many ways, but there's one more, just to add to what you had said before as well. We think that when you put, say, hardware and software together and use cases together, the real competitive edge, in our opinion, may not come from necessarily the software.
Correct.
It might be a unique sensor which collects unique data.
Correct.
An AI algorithm is only as good as data.
Correct.
That
And the
collect.
sensor that is behind
exactly. Therefore, we think that use cases and a good understanding of use cases and the sensors and the hardware that goes with it are equally important in actually giving that competitive advantage. And those areas do require depth, right?
Serious
and that's
depth, yeah.
partly the reason why a lot of the people who get into this space are people who have spent many more years
In
working
this
on
area,
it, maybe as PhDs, students, or
somebody who's
or who has
worked
worked in the industry for several years in research kind of backgrounds, or tech development backgrounds, who are actually bringing those who have sort of made their refined their capabilities over a period of time, especially with regards to both understanding the problem and putting the tool sets together.
Correct.
So it's not surprising. World over, I think in deep tech you have a little higher percentage of people trained in with higher education in sciences and engineering,
or professional,
and even doctors,
doctors.
any scientific training, people with those backgrounds that they do come in. It's not that others cannot participate, by the way, and we know very good examples of those as well. But I think there's one other aspect which helps, which is, for example, a very key element of a deep tech in a startup is the foresight of what is possible with technology. Right? So imagine, for example, somebody imagining say what is possible with mRNA technologies, right? It's very difficult to think that somebody who has not understood any of that can imagine what is possible with mRNA technologies. For example, mRNA technologies allows you to get your body to produce any protein of your choice. Okay, that basically could in principle include insulin.
Correct.
So imagine if your body was producing the insulin, what it makes huge difference, right?
Yes,
So,
yes,
but
yes.
somebody has to
And
foresee that,
that depth of knowledge.
yeah, and also at the point
Yeah.
when it was discovered,
Yeah, yeah.
right? And that requires a little bit, somebody who pursues that field a
Correct.
little more closely,
Correct.
right? So that's one of the reasons why you have so many
PhDs.
PhDs in the
It's very
field.
interesting. I'm just reminded
Yeah,
when we started A-Tight Networks,
yeah,
I was kind of not the few. We were surrounded by PhD, Dr. Praveen Bhagwat, Dr. Kaustubh Panse, Dr. Hemant Chaskar, Dr. Deepak Gupta. I said, I almost feel illiterate among you guys. But you know, we used to always comment, putting a sensor to catch airwaves, a third-year student can do.
Mhm.
But catching them sensibly and making a sensor that solves a world problem
Yeah,
requires the depth. So I'm
yeah,
absolutely,
yeah.
Dr. Premnath, looking forward to
May
this.
I just add one quick point? You
Mhm,
asked about retail
mhm,
and other areas and how people would benefit
mhm,
from this particular program as well, the panel that we have planned.
mhm,
It's important to understand that I think deep tech would be relevant
mhm.
for every sector.
Correct.
Okay, and it is going to transform every sector, and it's
Mhm.
important that entrepreneurs in every field
Pick
learn
it up, yeah.
generic lessons from the current group of deep tech
You're so right.
startups.
You
Yeah,
know,
yeah,
I was talking to, Mayur Datar,
yeah.
right? Chief Data Scientist, Flipkart.
Mhm.
He's giving a before you after deep tech state of the art on data. One of the comments he made to me when we were talking, that first time we got access to such voluminous data in large scale organized online retail,
Yeah,
on which the algorithms now start making sense, or
yes,
they get stressed.
yeah,
So it could be retail to all the way to deep sensors. The thing that I feel good about, that we as the craftspeople of data and computer
yeah,
science always have some challenging problem to work on. Uh, I know we are limited by time,
yeah.
but I think we should have more conversations on this going forward so that we can bring some of this for our entrepreneurs. So thank you, Dr. Premnath.
Thank you very
And
much.
viewers, please, register for TiECon. There is lot for each one of us there to learn, listen, learn, and network with people like him and the panelists and the other participants. Thank you.
Yeah, thank you.